Welcome to episode 26 of Dr. G at the Heart of Healthcare. This episode is about the continuum of care during the late stages of life, and I have an expert here, one of my LinkedIn friends. At this point, I think LinkedIn needs to send me a check because I keep highlighting everyone on my podcast. So I
Agreed.
have the Chief Growth Officer, Jackie Yavarino. Did I say it right?
You did. You
Yay,
you
of
rocked it.
Parentis Health. So thank you for being here.
Thank you so much for having me, Dr. G. This is wonderful opportunity. Thank you.
Ah, I'm meeting so many amazing people. First season of my podcast. I'll be wrapping up soon, as you know, for World Hospice and Palliative Care Day. We're going to go live and we have a special surprise and special announcement, but we're still here unpacking a few things for a couple weeks. So thanks for being here.
Thank you for having me.
Yeah. So we wanted to talk about the continuum of care, kind of con- continuing, not to be redundant, but
Sure.
yeah, last week we talked about crisis mode, when people are needing to consider placing their parent, their spouse, their brother, sister, or other loved one in a boarding care. It was assisted living week. So we talked about RCFEs. So we're kind of dealt with that. But I wanted to kind of broaden the spectrum so that people can understand how we should look at things during the late stages of life, which I consider like the last 2 to 10 years of life, depending on someone's illness. But I want to just give you the floor so you can let us know a little bit about your background. I know you just started a new
Mhm.
position, but just tell us about, just your thoughts on that and let's roll with it.
Sure. Well, thank you. And my background is quite extensive in healthcare. For the last 15 plus years, I've been predominantly in hospice, which end of life truly is a passion for me. It always has been. And obviously, I did not know about hospice at the time until I had a personal experience and never looked back. But then I always realized as the years went by that we were limiting ourselves, right? Well, why not look beyond the end of life? Let's try to look at prior to that. And I've worked with so many agencies that maybe did home health and hospice, maybe they dabbled in home care and did hospice. But what I love now is I get the opportunity to really work from the time that they're from, let's say, RCFE, which you talked about, right? And let's say all of a sudden, mom or dad is just needing some care at home. They just need, light housekeeping. Maybe they just need someone to help them around the house, transportation. So then home care comes in. Then all of a sudden, let's say mom or dad, they end up falling, they go to the hospital, they are in need of, physical therapy. Well, then home health comes in while home care is still involved. Little did we know that, they also had congestive heart failure or some other comorbidities. And there's, some decline, maybe it's slow. And then all of a sudden, hospice can be brought in once they meet the criteria for congestive heart failure. And during that entire time, the biggest piece is that they were able to stay at home. And yes, they
Mm,
did have the trip to the hospital, which obviously that happens and we know that. But
hmm
what if we could avoid that?
hmm
What if we could catch that time before they actually go into the hospital? And I think at Parentis, that's one of the things that we're trying to do is keep them at home as long as possible. And there are times, obviously, that 911 is called. And we even know that at the end of life, as much as we tell our families, we are your 911, they call,
hmm
they call 911, and we understand that. But what if we could truly, truly provide that full care continuum from the very beginning? And I feel that that's what we're capturing now. It's 2003, they started with, RCFEs, and they quickly realized that a lot of those residents that they had in the boarding cares were declining. And they were
hmm
using all these other resources, right? Other home health agencies, other hospices, other home care agencies. So they started their own, what we call the umbrella of services. And then in 2015, they started home care, hospice, and home health. And truly, I think it's just really about what I'm finding. It's still education. We still have to educate the public. We still have to educate our referral sources, the hospitals, the case managers, because sometimes the right discharge plan is just not given.
Mm.
And what that means is sometimes the easiest is just say, okay, let's just send them to a skilled nursing facility. I'm a caregiver. I take care of my mother. I know that she would not want to go into a skilled nursing facility. And I've been
Right.
able to provide all those services for her at home, whether it's a podiatrist, whether it's, even a dentist will come to your home, physician will come to the home, correct? Mobile physicians. So,
Yay.
yes. And I
I
mean,
do.
it's a big deal of, first of all, the engagement that you have with that patient, but it's also now you're being able to bring all those critical pieces to the home, and they still feel like they have a purpose in their home.
Oh,
So, it's amazing. I honestly feel that at this point of my career, I've done so many facets, maybe a couple of those continuums, but now I truly get to do them all. And the one piece that I didn't mention is we also do transportation. So that's another point that we're working with other programs, whether it's the PACE program or even our own hospice patients that need transportation. Let's think about our seniors. A lot of them, my mom is one of them. She doesn't drive and she needs to get to her appointments. Typically, it's myself. But
mm-hmm.
what about other families and other patients that don't have a family unit? So now you're able, Medicare will pay for that. Those are the resources that our clients need to know about that
Yes.
are available to them.
Woo, that was a mouthful, a earful, and a brainful. Like that's exciting, and it's encouraging to me. I recently did a presentation with the North Inland Senior Providers talking about the continuum of care. And just I really focused on when people are ready for hospice because I
Mhm.
feel like that's something everyone's afraid of. That's why I do this podcast. And
True.
I like to that's the expertise that I can bring. But I love seeing that people are embracing this continuum of care a little bit more and understanding that we need to make these transitions of care a little bit smoother, right? Do we need 10 hospitalizations the last year of life? No one's trying to withhold the hospital from you, but it's
Right.
stressful.
It
It's
is.
it's it's stressful. It's chaos. A caregiver on my Instagram this week, was a lot of beautiful caregivers. They
Mm-hmm.
share their journeys and they created a community online so
Mm-hmm.
they can support one another. And she was just stating how she's emotionally burnt out and things
Mm-hmm.
of that, the things we know that caregivers
Right.
suffer with. And what if she had, something like Parentis or someone else across the country, can do this model
Right.
and seniors have what they need at the end of life. So it's not chaos. I think people most of the time we want to age at home, right?
Mm-hmm. Mm-hmm.
People, we talked about people buying their dream home when they're 40, 50, and they think, well, I don't know if people really plan this out, but are considering when I'm
Right.
90, I
Right.
want to make sure that I can be here and my 401k is going to pay for the caregivers to see me. I don't know if people really plan that out, but what if we had services like, what you're talking about to just keep everything stable and the same staff, who has boarding care, as you mentioned,
Right.
for people can move there. So that's great. Like, how can we help educate these case managers and the public? That's my audience to understand this.
And that is such a good point. I wanted to go back to what you mentioned about the caregiver burnout. It's
Mm,
real. And I will tell you that COVID has changed us. I
mm,
think in this industry. I mean, we never had a break. I mean, I was in the midst of working in hospice during that time. And,
mm-hmm.
we were like getting PPE in and running to the hospital. And think about the things that we had to do. Families had to say goodbye over FaceTime. I mean, I
Sad.
still get emotional. It's sad because they couldn't come into the hospital, right? And I
Mm,
think to myself, I can't imagine if that were to happen. So, to your point about the hospitalizations, we're not saying that it's that we don't want them to utilize it. We know it's there for a reason, right? But we do have to educate. I think it goes beyond even to be before the home care because the goal is even on the financial side, right? Let's say a
mm,
fiduciary that is really in charge not only of just the monetary of a client but also their health. And so educating one of the associations that I'm involved with, the Professional Fiduciaries Association, which is PFAC of California, educating them that yes, I understand that you hold the money for these clients, but let's educate them on home care, what that looks like. Do they have a long-term care policy? You do know that that does help pay for that, as well as possible assisted living. And then being able to really be out, like one of the things we're doing a lot of is senior centers, doing a lot of these fairs, right? Because I still feel that as much as we get the word out to hospitals, case managers, there it's still we have to interact with the public. And so many times, even I'll tell you, my mom she's like my marketer in her community. She lives in an independent living, and she's like,
mm-hmm.
oh, number so and the next door needs your help. Can you talk to her about her insurance? And it's crazy to me because I think to myself, this is just one area, right? That I'm looking most of our clients don't understand what they have and what they can get for coverage, whether it's like I mentioned, home care, which is private pay, but maybe they have a long-term care policy. They didn't even realize that they could use that. And we assist in that
Mm-hmm.
process of making sure that they can convert that to hours. So I think it's all these pieces that for me, I am all about educating the actual consumer, just like you said earlier. I feel that's where we have a lot of work to do. We have for that outreach, and it's in all facets, independent living, because they don't have any assisted living there, right? To assisted living communities, to senior centers, to, doing booths in certain health fairs because we want to gather 55 and older. I mean, we get a lot of referrals for home care with 55 and older communities because maybe there's a husband and wife and one, is starting to decline, but they start out with home care slowly and maybe they just need a few hours here and there. And the whole goal again is to avoid that hospitalization and for them to stay healthy. So I think
Yeah.
there's so many facets. I feel that marketing, but marketing with a purpose. I always am all about that you have to market with a purpose. And I always think the intention behind it is important because I know that that's what I would want. I know that I would want to stay at home. And so the more that we can get the word out in all these communities, I think the better.
Yeah, I love what you said about educating them and being upstream, like the professional fiduciary folks. I often interact with a couple of them when I do a 602 for
Yeah.
Oasis, for instance, or I just do that here and there. But how powerful of an impact could we have? For our seniors,
Mm-hmm.
these baby boomers that are coming, if we really worked upstream with the education about the continuity of care during the late stages of life so that everyone knows. So we're not just like, well, what should we do? And, people are
Right.
becoming frustrated. I remember one person I spoke with who's a fiduciary in the area, and he was kind of frustrated with what was happening with his client
Mm-hmm.
at the sniff. And he's like, oh, maybe I'll get a mobile physician to go in. Can you go see them? And then we kind of kept talking. And I realized that was a person I had done a 602 on a year
Wow.
prior, and she was declining. So see what I
Oh,
mean? That's
right,
that's exactly what you're saying.
right,
What if I could have been following her the whole time, or
right,
Parentis or some type of model could have been
right.
following her, so she's not in this uncertain situation, at
Right.
the end of life. So that's powerful. Wow. I don't know. I'm going to keep saying wow. My listeners are going to get tired of me saying wow. Um, there's so much to unpack here. So how
Yeah.
can maybe people can just reach out on the website and maybe learn a little bit more about the continuity of care through the
Absolutely.
Parentis website?
Yeah, so you can absolutely find us at parentishealth.com, and you'll see definitely a full spectrum. And sometimes it's a little overwhelming for people. I am available anytime. That's one of the things for me. I am taking calls, after hour calls, and speaking with families and guiding them through the process because I want to see what our spectrum looks like, right? But I feel that it has to start somewhere. And sometimes it's just a question. One of the things that you and I talked about is let's not wait until it's a crisis. Let's
Yes.
let's do it early on so that there is a plan in place. Nothing is perfect. However, it can be a beautiful thing if it's done the right way. And then all of a sudden you're able to sit back and see that someone is truly enjoying their life in the way that they should. So yes,
Yeah.
absolutely reach out. I'm available, and you can find me on the actual website as well and navigate through the leadership team.
Awesome. And I want to rewind a sec and just acknowledge what you said about the pandemic. I know all of us were over it, but I saw the emotion well up for you, and I also have that same emotion because we really went through a traumatic thing,
Mhm.
um,
Yeah,
as a society,
as a
actually as
society.
a globe. I mean,
Mhm.
everywhere, and
Yeah.
in families, everybody was touched by that.
Mhm.
And so thank you for saying that and reminding us we're still healing
We're
and we're
still
still
healing.
recovering from that, and
Mhm.
all the lessons we learned from that
Mhm.
um, craziness we
Yes.
should use to apply to the senior communities now and have things in place for them so that they can have a beautiful ending. And so I think that's where we can start. So I don't know, what do you have planned this weekend? I like to kind of get it a little light and not be so
Oh, I
heavy
know
all the
that was
time because
intense.
it can get intense
It
out
can get
here.
intense. We are all about, our kids are older, but we still spend a lot of time with family. But we are doing some music. We love music. I know you love music, and we're going
Hmm.
to a live performance at the Moonlight Theater this evening. And
Hmm.
then I am doing a dinner birthday party, an 80th tomorrow night, and I think Sunday will be my retreat day just to relax and get ready for a busy week. So,
Yeah, well, I'll be cleaning and watching football. Everyone knows about my team,
oh,
but I
that's
love.
right. That's right. You're
I
sporting the colors. I love it.
I'm always ready. So no, I really I admire you, and I know we're going to have many more conversations. I'll have to invite you
Absolutely.
back, but I know you shared with me about being a caregiver yourself. You're this powerhouse in healthcare, but also you're living it with your
Yeah.
89-year-old mother and matriarch of the
Yeah,
family.
she is.
And I remember something you said when we first spoke on the phone, how you've said, I am not everything. But even you are. It's ironic. You actually are, but then you
Yeah.
said that. And what does that mean to you? Is that like an emotional boundary? Like leave that tidbit with us so people can be empowered and feel some peace of mind.
I feel that I'm a perfectionist, and I was raised by a perfectionist, so I'm now caring for her. And when
Hmm.
I said that, I meant that I have made all those arrangements for her to have a very comfortable life. All her things are taken care of. She hasn't had any hospitalizations in several years. And I'm proud of that. But then there's
Hmm.
also the social aspect. I work a lot, right? And when I said that, I meant that, so now I'm looking at other aspects for her to have more socialization. So a different program that will actually pick her up. take her out because and then I noticed it's like at the end of the day, one of the things that I realized about her and most seniors, they want to be needed. They want a purpose.
Mm.
I know it gets me, but we all want a purpose, right? Um,
We breathe that in.
yeah. So I sometimes, and I maybe got frustrated with her not realizing that. And um, we have to give that purpose back. That's our
Mm.
responsibility because I mean, we have children. We don't expect that they care for us. We're planting these seeds so that we can care for ourselves. But what a privilege to be able to care for her. I'm blessed that I still have her with us. So I'll leave it at that.
And I just breathe all that emotion in because I think people needed to hear that.
Yeah.
And I am staying at my kids' house. I told them I'm gonna have a room at everybody's house. So I don't know. I'm different. But anyway, thank you for sharing that and
Uh,
being
Thank you,
vulnerable.
Jen. Thank you, Dr. G.
Um, Thank you, everyone. If you have any more questions, I'll put those things in the show notes, even the fiduciary organization. Maybe we can send this to them and talk to some of them. We're going to put Parentis Health on there. LinkedIn, you better call me because I'm like interviewing everybody on here.
I know.
So
I know.
thank you. We're winding down the season. This is episode 26. I think we have one or two more before that live stream. I hope everyone registers on Eventbrite, but thank you for tuning in. Peace, everyone. Thanks, Jackie.
Thank you, Dr. G.